COVID-19 symptoms have been getting longer and stranger throughout this pandemic. Given how many people are now vaccinated, it is becoming harder to distinguish the early warning signs of an infection. This makes it more difficult for healthcare professionals to respond quickly. With the Omicron variant roaming around, people are discovering just how far-reaching it is. An international team of researchers has been following the course of the disease with COVID Symptom Study mobile app where users can submit their own symptoms. Data regarding Omicron's variant is still preliminary, but a group of 171 app users in the United Kingdom, mostly vaccinated, have reported the following symptoms: runny nose, headache, fatigue, sneezing and sore throat. These were also the top symptoms for people infected with the Delta variant. That's a departure from the classic 3 COVID-19 symptoms of fever, cough, and loss of sense of smell or taste associated with earlier variants, researchers say. For most people, an Omicron-positive case will feel much more like the common cold. Symptoms include a sore throat, cough, and headache, according to a research. According to an UK agency, of the 171 people in a recent symptom analysis who were either suspected or confirmed with Omicron, only half of them reported fever, coughs, and a loss of taste and smell. Researchers in Norway recently reported similar findings from an Omicron outbreak among fully vaccinated guests of a Christmas party. 87 people have been confirmed or suspected to have the flu. The most common symptoms were a cough, a runny and stuffy nose, feeling tired, a sore throat, and a headache. Just over half of the participants reported having a fever, while 23% experienced a loss in taste. 12 people also experienced reduced sense of smell. The Omicron strain of this virus is the most prevalent version. In addition, it seems to be better able to compete with immunity. Despite conspiracy theories and misinformation about vaccines, they still offer good protection from serious illness. Everyone should get a booster shot for maximum protection. According to the Centers for Disease Control, in the United States of America, we know we will continue to hear more about people who get infected who are vaccinated. These people may get mild or asymptomatic infections and could unknowingly spread those infections to others. Countries like South Africa and India have already counteracted the effects of the Omicron variant. Widespread vaccinations, even before infection, seem to have helped provide immunity for these areas of the world. Omicron is becoming an increasingly dangerous in India for people with respiratory and heart disease. According to the Centers for Disease Control and Prevention, the Omicron symptoms that demand emergency medical care include sudden confusion, inability to stay awake, persistent chest pain or pressure, trouble breathing, and lips, fingernail beds, and skin turning blue, pale, or gray. A smaller percentage of those infected by this virus will go to the hospital, but the overall increase in cases from Omicron could result in enough people getting sick to overwhelm current healthcare system, including those in US, Europe and India. In addition, many illnesses have mild symptoms to begin with, and COVID-19 treatments are most effective early on. The emergence of the cold-like symptoms with the Omicron variant means that getting tested to confirm whether someone is infected with COVID-19 is more critical than ever to slow the spread of the virus. People with pre-existing health conditions are more vulnerable to developing infections, so it is important to identify symptoms as soon as possible. With early detection, effective treatments can be administered in time. Frequent testing for COVID-19 can catch Omicron cases, but they have a lower level of accuracy. To prevent COVID-19, you need to get vaccinated and get a booster dose if eligible. Carry an effective mask in public and follow the social distancing guidelines. Although there has been a recent mutation of a pandemic virus, following these steps can help reduce the risk of it spreading and save you and your loved ones from getting infected.